Students, today class we are going to discuss about Nsides. So flow of discussion is like this. First we are going to see what are Nsides, what's its actions, mechanism of action, classifications, uses, adverse effects, end up with few points about COX-2 inhibitors. NSAID's full form is non-steroidal anti-inflammatory drugs. Students should remember the important point: anti-inflammatory drugs. Two potent anti-inflammatory drugs are available. One is steroid, other one is this non-steroidal anti-inflammatory drug. So what is the purpose of this use of NSAIDs? They have three important actions. First, they are analgesics. Analgesic means it helps to remove the pain, and antipyretic reduces the temperature during fever. Anti-inflammatory, if there is any inflammation in the body, these drugs can help in reduce the inflammation. How these NSAIDs act? As I already mentioned, this pain, fever and inflammation are most commonly produced by prostaglandins. These prostaglandins are produced by the enzymes cyclooxygenase, COX enzyme. NSAIDs, by inhibiting COX enzyme, they reduces the production of prostaglandins, thereby it's result in analgesia, antipyretic and anti-inflammatory effect. So before we proceed to the classification of NSAIDs, we should know that there are not a single COX enzymes. Usually there are two type of COX enzymes are there, COX-1 and COX-2. In general, when we take it as a blanket term, this COX-1, which carries out most of the housekeeping enzymes of our body, like gastric mucosal productions and so many housekeeping actions. And COX-2 mainly involved with this problematic inflammatory process. Based on these inhibitions, we can classify these NSAIDs. Based on this inhibition of these enzymes, we can classify NSAIDs. As I already said, when an NSAID inhibits both COX-1 and COX-2, they are called as non-selective COX inhibitors. So our medical scientist thought that by selectively inhibiting COX-2, we produces a superior drug with a minimal adverse effect. So they keep on analyzing and end up with selective COX-2 inhibitors. But when these COX-2 inhibitors came into use, we found there are other drawbacks with COX-2 inhibitors. We will discuss during this course of this class. Here for classification sake, we can know this as a non-selective COX inhibitors and selective COX inhibitors. In between there is one more small minor group called as preferential COX-2 inhibitors. This non-selective COX inhibitors, important drugs in these groups are aspirin, indomethacin, ibuprofen, mefenamic acid. These are all important non-selective COX inhibitors. The selective COX-2 inhibitors, the important drugs are celecoxib, toricoxib and pericoxib, but they are not in general use because of a certain adverse effects. And one more group is there is a third group, and NSAIDs with minimal or poor anti-inflammatory action. Most important drug and a common used drug is paracetamol. So what are the uses of these NSAIDs? They helps in reducing the pain, analgesic, for example in the case of headache or backache, when we develop any muscle pains, this NSAIDs helps in reducing the pain levels. The dose is varied according to the drug. They helps in antipyretic effect also. In the case of fever, when you use these drugs, it helps in normalizing the body temperature. As I said, it has anti-inflammatory effect. For example, in the rheumatoid arthritis, osteoarthritis, there is so much of inflammation in the body. These NSAIDs alleviate this inflammatory effect, and which helps in reduction of pain and improved mobilities. And finally, the word about this aspirin, even though aspirin is an NSAID initially used for analgesic antipyretic purposes, but later we found that this aspirin at a low dose is a very good antiplatelet drug. So aspirin nowadays not commonly used for analgesic purpose. It is used in cardiology department, in the post-myocardial, even in anginal patients. The aspirin is preferred in the low dose, around 75 to 150 milligram, even up to 325 milligrams. Somebody considers as a low dose. And they help in post-myocardial infarctions, even in angina, for their antiplatelet effects. Adverse effect, as I already said, that this COX-1 enzyme is involved in many housekeeping functions. As a student should remember these two important adverse effects. First one is gastrointestinal adverse effect. When you use NSAIDs, almost you expect they tend to produce so much of gastric ulcerations and intolerance. Because of their prostaglandins, inhibiting prostaglandin effect in kidney, they produce so many renal problems also. So as I already said, for example, but these gastrointestinal adverse effects are very less with paracetamol. Student understand that also. So to reduce these effects, scientists believe that when we develop a drug with selective COX-2 inhibitions, they thought that the gastrointestinal adverse effects will be very less. So they produces selective COX-2 inhibitors like celecoxib, and they have very less gastric problems. But in the common use, we found that this selective COX inhibitors increases so many cardiac problems. They may aggravate thrombotic problems. Why it occurs means the COX-1 inhibitor is responsible for anti-platelet aggregatory effect. Since it selectively COX-2 inhibitors are used, this anti-aggregatory effect are lost, and it may shift the balance towards a thrombotic side. There is more chances of thrombotic problems the patient using COX-2 inhibitors. So nowadays these COX-2 inhibitors are not preferred, and it is used only in the selective patients. When you use COX-2 inhibitors, the balance between thromboxane A2 and the prostaglandin I2 is shift more towards the thromboxane A2, and a thrombotic state occurs. So nowadays these COX-2 selective COX-2 inhibitors are not generally used. It's only preferred in selective cases. I give a brief outline about this NSAID class. I expect students to go and prepare individual drugs. For example, you should prepare what is aspirin and what is its uses, and what is brufen and what are its uses, what is paracetamol and its uses, and the toxicity and antidote for paracetamol poisoning. Students should go and read about individual drugs. Here I provide this brief outline. Based on this outline, I expect student to read about the individual drugs. And hope this NSI class is more informative to you. Thank you for your patient attention.